I'm Craig McCowan. I'm the president and one of 4 principal owners of MedServ Plus Incorporated. Since we've become involved with the Samsung diagnostic imaging product approximately 2 years ago, one of the biggest and most exciting things for me to witness is the excitement level that we see in our customers. There's a video that we show when we're doing presentations for large customer groups, and the title of the video is "How Big is Samsung?" And I don't believe that the average person really understands the size of Samsung as a global corporation. I think the average person believes that they sell smartphones and TVs and appliances and telephones and now x-ray equipment. But what they don't understand until we show them the video is the fact that they're in the shipbuilding business. They have their own Samsung Medical Center. They have their own clothing line. So it's very exciting to see once our customers witness how big Samsung is and they understand that Samsung's bringing a technology level to diagnostic imaging that we're presenting to them, their excitement level goes through the roof right out of the gate. Then we get to show them the equipment throughout our presentations, and then they get to witness the equipment by doing a product demonstration for them. And the term wow factor has been used over and over when it comes to what Samsung has done in the imaging business. And I can truly attest to the fact that our customers come up to us after presentations, after demonstrations, and they can't believe what they've witnessed. So Samsung has definitely brought the excitement level back to X-ray, and they've done it through the technology that they've developed in other companies that they own, and they've brought that technology to the imaging business.
Hello, my name is Vincent Hudson. I'm the Chief Operating Officer here at OAA Orthopedic Specialists in Allentown, Pennsylvania. We're a 25-physician practice, predominantly in musculoskeletal surgery and a variety of other areas, including rheumatology, pain management, and physiatry. We deal with many different varieties of patients regarding everything from sports medicine to hand to joint and to spine injuries. Our organization was started in 1971 by Dr. Peter Keblish. He was an institute in the presentation and the work on joint replacement, both knees and hips. From there, we have grown over the years up to the 25 physicians we presently have today, with 3 facilities throughout the Lehigh Valley area. Well, there are a number of reasons why we chose Samsung. First, I actually had very little understanding or knowledge of Samsung's history of being such a leader in the world in technology. And when we learned more about them, one of the key issues for us, as anyone in healthcare today, was cost as well as quality. And when we learned more about Samsung and the products that they have, the quality surpassed any of our expectations or any of the expectations we had from previous providers and previous organizations who dealt in imaging. The other portion, obviously, was the quality of the imaging. Running an organization with 25 physicians who take thousands of x-rays a month, we had to go find a group that would provide us with the highest quality of imaging and technology, and that's why we sided with Samsung. Well, the installation was announced. Usually in common, and we've put a lot of machinery within our organization over the years. It's usually a nightmare, and it was an amazing process. The communication, first of all, was outstanding. I knew the date, I knew the time, I knew the number of people, I knew the timing of when they were going to install, where they were going to install. We installed 4 separate units over a period of 7 days, which is unheard of because we also once uninstalled 4 units in the same period of time. So the communication was outstanding. The resources that came in with the Samsung group was again superb. The technologists who came in the clinical staff who came in and supported my clinical staff in educating them about the utilization of the machinery and the technology, again, was outstanding. So the total installation process was far and above what I was expecting to take on with the installation of 4 units in an extremely busy orthopedic practice.
My name is Michelle Yursitz. I am an X-ray tech here at OAA Orthopedic Specialist. I've been an X-ray tech for 25 years and I have been working here at OAA for 15. My job description is a radiologic technologist and I'm also the radiology manager. Because we are so busy, we do see a tremendous amount of patients in any given day. Our patient base goes anywhere from very young children, elderly, to very sick and severely injured people. So with the use of the Samsung unit, it's very nice because we have a portable detector which is used with patients that can't be moved a whole lot. We can take that portable detector and move them very minimally and yet get very good image quality for that particular patient. Other patients that are a little bit more mobile, the unit moves very smoothly into positions where we can just simply have them stand and do the X-ray in that position. So it keeps the flow moving a lot more quickly, and we keep the quality of the films where they need to be, and of course patient care is of utmost importance. So the patient's anxiety and comfort is really what's most important, and we do keep the anxiety to a very low level. The use of this tube head here has all of the KVMA and all the other areas that you would need to probably adjust in the event that you're doing the patient one-on-one. One of the nice factors is that if you have a patient with you for, say, some steady, it's nice that you're able to adjust your factors right here in front of you while that patient is with you. Because leaving the patient to have to go back to the console and change it on the workstation would take time away from that patient who needs your attention there with them. So by the use of having the capability of changing anything on this screen right at with your patient with you, that is a tremendous asset in patient care. I think the thing that is most precise about this equipment is that the definition of the quality of the films is of top quality. With that being said, our doctors can make the most precise, accurate diagnoses for all their patients that they see, at the same time giving them the least possible dose of radiation, which in today's society is very important, that people are given the least amount of dose to get the top answer to their problems and what the solution would be for their pain or trauma that they've had to the area. So with the equipment, I think that the doctors can be most accurate in their diagnoses and treatment of the patients.
It's been very exciting for me to witness what's transpired over the last 18 months as we move into our second full year of distribution of Samsung X-ray equipment. We've over doubled the sales volume, the number of systems being put into the field. We have doubled in less than 18 months. And with CT and MR and ultrasound and mammography and cardiology products on the timeline and being brought to fruition over the next 3 years, we fully expect for the sales forecast to be on a very steep trajectory, and we expect that to be long term.